You probably tossed that envelope right into the recycling bin, thinking it was just another piece of junk mail from the insurance company, and in doing that, you might have just thrown away the exact Medicare upgrade you have been waiting for. I am Jake Morrison. Today we are looking at a massive shift in how the system handles your out-of-pocket medical costs this week, and more importantly, the specific hidden benefits you are currently paying for but absolutely not using. By the time we finish this conversation, you will know exactly which form to demand to stop the bleeding on your pharmacy bills, and I am going to reveal the single most overlooked credit that could wipe out your monthly premium entirely if you happen to sit in the right income bracket. I spent over 15 years working deep inside the retirement tax and benefit system. I watched the machinery operate from the inside out. I saw exactly how the system is designed to be just complicated enough that honest, hardworking seniors give up and leave their own money on the table. Now, I translate that bureaucratic mess into plain English for you. I am not selling you a guide. I am not pushing an online course. There is no secret checklist to buy in the description below. This channel has nothing to sell. This is your money. You already worked decades for it. I just want to make sure you actually get to keep it. If that kind of honest, no-nonsense translation is something you value, hit the subscribe button right now. The rules change constantly, and the people who stay subscribed here are the ones who never miss a dime. Let us start with something that catches millions of seniors completely off guard. It is the Medicare Savings Program. Your standard Medicare Part B comes with a monthly premium that gets yanked straight out of your Social Security check before you even see the money. For a lot of people, that premium deduction hurts. You feel it every single month. But there are state-run programs designed specifically to step in and pay that Part B premium for you. The catch is that it is strictly based on your income and assets, and absolutely no one is going to automatically enroll you. The government will happily keep deducting that premium from your check until the day you die, unless you explicitly raise your hand and apply through your state's Medicaid office. You have to fill out the paperwork. You have to prove your income. But if you clear the threshold, that premium deduction stops immediately and your monthly Social Security check goes up. It is that simple. Right alongside that is a federal program called Extra Help. This is strictly for your prescription drug costs under Part D. If you are scraping by and choosing between groceries and your medication, this is the lifeline you are supposed to have. It lowers your premiums, limits your deductibles, and puts a hard ceiling on what you pay at the pharmacy counter. But here is the catch that ruins it for so many. People assume that because they were perhaps denied for a Medicare savings program, they will also be automatically denied for Extra Help. That is entirely false. The income limits for Extra Help are often much more forgiving. You apply for this one straight through the Social Security Administration, not the state. If you are struggling with pharmacy bills, you need to submit that application regardless of what you assume your chances are. Let them tell you no. Do not tell yourself no. Stay with me, because the next one changes everything about how you handle a hospital emergency. Imagine you have a fall. You go to the emergency room, they put you in a bed, you stay there for 3 days, and then they transfer you to a skilled nursing facility to recover. You think Medicare Part A is covering the rehab because you were in the hospital for the required 3 days. Months later, you get a bill that could wipe out your entire savings. Why? Because you were never officially admitted to the hospital. You were kept under what the system calls observation status. To Medicare, observation status means you were an outpatient the entire time, even if you slept in a hospital bed, wore a hospital gown, and ate hospital food. The catch is purely semantic, but the financial devastation is incredibly real. You must always explicitly ask the attending physician or the charge nurse, "Are you admitting me as an inpatient, or am I here on observation status?" Demand the answer in writing. If they say observation, you need to understand right then and there that your subsequent rehab stay is not going to be covered the same way. But here is the one almost nobody knows about, and it happens right at your doctor's front desk. Medicare covers an annual wellness visit completely free of charge, no copay, no deductible. It is a fantastic benefit meant to help you and your doctor map out a preventive care plan for the year. But if you call your clinic and say you need to schedule your annual physical, you just stepped on a massive landmine. Medicare does not cover a routine physical exam. A physical involves blood work, touching, poking, and a deep diagnostic dive. A wellness visit is basically a conversation, a cognitive check, and a questionnaire. The catch is that the billing department codes the visit based on what you asked for and what the doctor performs. If you use the wrong word, you will get a bill. When you call, you must use the exact phrase, "annual wellness visit." Your benefits aren't hidden, they are just trapped behind the right vocabulary. Now you might be thinking, Jake, this sounds too easy. If this money is just sitting there and these rules are so clear, why wouldn't the government just automatically apply these credits to my account or automatically fix the hospital billing? Here is the brutal truth. The system is fundamentally built on friction. They rely on you getting frustrated, getting confused, and simply walking away. The machinery moves incredibly slowly, and every form you do not fill out is a dollar that stays in their budget instead of your bank account. It is not a grand, shadowy conspiracy. It is just the cold reality of a massive bureaucracy. They are not going to hold your hand. You have to advocate for yourself. Let us look at how that friction plays out with preventive screenings. Medicare loves preventive care. They want you getting your colonoscopies, your mammograms, your bone density scans. They cover these at 100%. You walk in, get the test, and walk out. But here is the catch that blindsides people every single day. If the doctor finds a polyp during that routine, free screening, and decides to remove it right there on the spot, the entire nature of the visit changes in the eyes of the billing department. It instantly switches from a preventive screening to a diagnostic procedure. The second it becomes diagnostic, your deductibles kick in and your standard copays apply. You wake up from the procedure thinking everything was free, and 2 weeks later, you owe hundreds of dollars. You cannot necessarily stop the doctor from removing a polyp, and you certainly wouldn't want to for your health, but you need to understand exactly why that bill arrives so you do not waste hours fighting a charge that is technically correct under their twisted rules. And speaking of doctors, we need to talk about Part B excess charges. When a doctor agrees to treat Medicare patients, they generally agree to accept the Medicare approved amount for a specific service. But some doctors do not accept Medicare assignment. That means they are legally allowed to charge you up to 15% more than the Medicare approved amount. That 15% is the excess charge, and you are entirely responsible for paying it out of your own pocket. The catch is that depending on exactly where you live, this might be completely illegal or it might be standard everyday practice. A handful of states have banned excess charges entirely. But if you live in a state that allows them, the burden is on you to ask the clinic up front. Do you accept Medicare assignment? If they say no, you have to decide right then if you are willing to pay that 15% surcharge just to see that specific doctor. Let us shift to something that feels like an outright punishment. The Part D late enrollment penalty. When you first become eligible for Medicare, you are expected to sign up for prescription drug coverage. If you decide you do not need it because you are perfectly healthy and do not take any medications, you are walking into a lifelong trap. If you go without creditable drug coverage for more than 63 days and then try to sign up later when you inevitably need a prescription, Medicare hits you with a penalty. The catch is that this penalty does not go away. It is permanently attached to your monthly premium for the rest of your life. It grows larger the longer you wait to sign up. The only way around it is if you had coverage from an employer or the VA that was considered just as good as Medicare. You must keep your notices of creditable coverage in a safe place. Those letters are your absolute ironclad defense against the penalty. This next one is for everyone who gets bombarded with television commercials every fall. Medicare Advantage plans push these flex cards and over-the-counter allowances incredibly hard. They promise you a preloaded debit card to buy vitamins, toothpaste, bandages, and sometimes even groceries. It sounds like free money. The catch is the expiration date. Most of these plans issue the funds on a strict quarterly basis, and if you do not spend the balance by the very last day of the quarter, it vanishes. It does not roll over. The insurance company knows exactly how many people will forget to use the card. They literally bank on your forgetfulness. You need to log into your plan portal, check that balance today, and go buy a year's supply of pain relievers if you have to. Do not let them take that money back. We are getting to the big one, the one that makes my blood boil every time I see it happen to a new retiree. The financial hit on this next item is staggering, and it happens strictly because the government is looking in the rearview mirror instead of at your actual life. I'm talking about IRMAA, the Income-Related Monthly Adjustment Amount. If you had a high income during your working years, Medicare charges you a massive surcharge on your Part B and Part D premiums. It can add hundreds of dollars a month to your baseline costs. The catch is how they calculate it. They use your tax return from 2 years ago. But think about what happens when you actually retire. Your income drops off a cliff. You stop working, but Medicare is still charging you premiums based on the big salary you had 24 months ago. They do not automatically adjust it just because you retired. You have to force them to look at your current reality. You do this by filing Form SSA 44. the life-changing event form. Retirement is officially considered a qualifying life-changing event. You submit this exact form, show them your newly reduced retirement income, and demand they remove the IRMAA surcharge immediately. If you recently retired and your premiums are through the roof, filing this form is the single most lucrative piece of paperwork you will ever fill out. Now, navigating all of these traps, the savings programs, the drug limits, the hospital coding, it can feel overwhelming. But there is a master key that unlocks almost all of this for you, and it doesn't cost a single dime. Every single state has a state health insurance assistance program, commonly known as SHIP. These are federally funded independent counselors whose only job is to untangle your specific Medicare situation. They do not sell insurance. They do not make commissions off you. They have direct access to the systems that determine your eligibility for the savings programs and extra help. The master move is calling your local SHIP office and requesting a comprehensive benefits review. You give them your medication list and your income range, and they will check every single database simultaneously. One conversation can lock in your extra help, swap you to a cheaper drug plan, and initiate your savings program application all at once. Loyalty to an insurance company is the most expensive mistake a retiree can make, but loyalty to a free independent counselor will save you thousands. So let us lock down exactly what you are doing next. You are calling the clinic and explicitly demanding an annual wellness visit. You are confronting the hospital charge nurse to confirm you are admitted as an inpatient and not simply on observation status. You are digging up Form SSA 44 if your retirement caused a massive income drop, but your premiums haven't moved. You are checking your wallet right now to drain the balance on your quarterly flex card before the insurance company steals it back, and you are finding the number for your local SHIP office to get a completely unbiased review of every program you are legally entitled to claim. You worked your entire life paying into a system that is quietly banking on your exhaustion. Every form they make difficult, every term they make confusing. It is all designed to keep the funds in their accounts instead of yours. I do not want you leaving another dollar behind. Think about the person in your life, your older brother, your neighbor, the friend you have coffee with, who is stressing over their pharmacy bills right now because they simply don't know the rules. Send this directly to them.